Welcome to page 155, Anatomy Coloring Book, the Male Reproductive System. This is Dr. Stephen Harkins. The male reproductive system consists of the scrotum, testes, epididymis, down the line here, and the penis. And the path is, it'll be helpful to follow the path of the creation of sperm and the distribution of sperm. So the first structure we want to highlight is the testes. And the testes is the male reproductive organ that creates the sperm. Surrounding the testes on the outside, or on the posterior and superior here, is the epididymis. The epididymis is the place where sperm is stored. Then, after the sperm is created in the testes and then stored in the epididymis, it is transported through this duct called the Ductus deferens, all the way out around the bladder, in piercing through the prostate gland, joining the urethra, and then out the penis. This path that the ductus deferens takes, here's the ductus deferens, the epididymis, of course, and the testes. It takes an interesting path because the ductus deferens does, because you'll notice it comes above the pubic bone here. The pubic bone, you would think that the testes would simply, or that the duct would simply go underneath in the same path that it exits, but it does not. So what happens along the path of the ductus deferens is it actually travels through the inguinal canal. This is above your pubic bone. This is above your pelvis. Through and pierces through your abdominal wall, through your oblique muscles, and then into the abdomen. And you can see kind of hooking around through the inguinal canal, hooking around behind the ureters of the bladder and behind the bladder itself, and into the prostate gland, and then joining up with the urethra. So the ductus deferens does not take a direct path, directly into the perineal area and then looping around and come back. No. It travels outside the abdominal wall, piercing through the abdominal wall, and then around the bladder and out. And along the way, you can it encounters the ductus deferens and the sperm. By the way, it's conducted this way because there's smooth muscle in the walls of the ductus deferens, and it's being squeezed upward, around and over. This little gland right here, the bulbourethral gland right here, is important because before the sperm ever gets in the urethra, this little gland squirts out a slippery substance that lubricates the vaginal wall, and it prepares also the urethra for the sperm to come through. So before the sperm ever comes out, there's a pre-ejaculatory fluid from the bulbourethral gland. Now, along the way, the sperm, what is added to the sperm right here from what is called the seminal vesicle, is a nutrient-filled fluid that adds into the sperm before it gets to the prostate gland. It's the seminal vesicle. And the prostate gland itself also adds a nutrient-rich fluid to the semen as well. So here we have the seminal vesicle and the prostate gland adding a fluid to the semen, nutrient-rich fluids, as well as the bulbourethral gland before ejaculation, preparing the urethra and the vagina for ejaculation. Now, this little section right here is the section where the ductus deferens becomes what is called the ejaculatory duct. This is the ejaculatory duct right here in red. Then the ejaculatory duct meets up or turns into what is known as the urethra. So the ductus deferens comes from the epididymis, and it's got this muscular, smooth muscle wall, and for a short time becomes the ejaculatory duct, and then eventually becomes the fluids are spilled into the urethra. So it goes from ductus deferens to ejaculatory duct to urethra. And you can see the path here: ductus deferens, ejaculatory duct, and then urethra. Now here we can see a view, a close-up view of the anterior view of the scrotum. The scrotum is the sac that the testes lie in. This is the scrotum, the scrotal sac. And of course we have the testes. You see here the epididymis, where the sperm is stored. You see the ductus deferens heading upward through the inguinal canal. And you can see the fascia, this cremasteric fascia, the layers, these sort of outer layers that the testes had to push through, push along during development. So we have the ductus deferens here, and the coverings, the outer coverings that were pushed through the spermatic cord that forms the coverings that form the spermatic cord during embryologic development, when the testes, or during fetal development, when the testes push down through the abdominal wall. These are the remaining coverings that they had to push through. Yeah. Now, deep inside the spermatic cord, along with the ductus deferens, is the testicular artery. The testicular artery is underneath here, and it is an artery obviously providing blood to the testes. And then there is the blue or venous blood returning backward, and it doesn't return in just it returns in a plexus called the pampiniform venous plexus. So the arteries inside, I should make it red actually, and then surrounding the artery is this venous plexus, which returns blood back to the heart and back to the body. One thing to note is this muscle right here, the Dartos muscle. This muscle contracts and relaxes. When it contracts, it brings the testes upward into closer to the body. When it's cold out, okay, the testes are outside of the body because the body is too warm and too hot. The testes need about a 95-degree Fahrenheit environment. So and the body is 98, 99 degrees Fahrenheit. So it's too warm for the testes. So the testes drop and they hang outside of the body in the scrotum. But this muscle, when it gets too cold, will pull the testes up closer to the body to add warmth and to raise the temperature or to maintain the temperature of the testes. And this is page 155 of Anatomy Coloring Book. This is Dr. Stephen Harkins.